Sometimes there are very subtle symptoms that can actually be a clue to something that is serious. And oftentimes these symptoms can be overlooked, such as the case of Sjogren syndrome. I'm going to share with you 5 key signs of Sjogren syndrome that you need to know. Symptom number 1, dry eye syndrome. Now, dry eye syndrome is extraordinarily common. However, in Sjogren syndrome, the symptoms are extreme and at times can affect daily activities such as looking at your phone or working on the computer. Symptoms often include the sensation of sand in your eyes and grittiness. At times can cause something called photophobia. Photophobia is the experience of pain when looking at light. Now, it can also cause serious complications like infection, corneal abrasion, corneal perforation, and in extreme situations, vision loss. So it's important to see an ophthalmologist when this is suspected so that they can test you properly. So some tests include a dye test as well as a Schirmer's test. Now, a Schirmer's test occurs when the doctor places a piece of paper onto your eye and then measures how quickly the paper will absorb your tears. So when diagnosed, there are several different treatments that are available, and these include artificial eye drops, plugs, Restasis, Xiidra, Tyrvaya, Mevo, and also certain supplements. Symptom number 2, dry mouth. Like dry eye syndrome, dry mouth is extraordinarily common. And in Sjogren syndrome, this experience is profound. But before going forward, let's understand what saliva does in the first place. The first thing it does is that it breaks down food. The second thing is that it helps wash away bacteria from our mouth into our gut so that it prevents cavity formation. So individuals with profound dry eye, like those with Sjogren syndrome, often experience recurrent dental cavities as well as thrush. Sometimes it's so profound and it also can cause difficulty swallowing and also can alter taste. Now, when this is suspected, it is important to see your dentist on a regular basis and oftentimes more frequently than typically recommended. Some things you can do are drinking frequent sips of water, as well as using certain over-the-counter products like Biotin mouthwash, but it's really important not to use regular mouthwash, as oftentimes these contain alcohol and can actually dry your mouth even more. It's important to floss 3 times a day and also to use sugarless products like sugarless candies. In extreme cases, we can also utilize medications like oral pilocarpine. However, it's really important to talk with your doctor about this, as there are multiple side effects and multiple contraindications to these medications. Symptom number 3, joint pain. Individuals with Sjogren syndrome often describe joint pain. Typically speaking, this joint pain is non-inflammatory in nature. Typically, the joint is not swollen. Typically, it is not warm. And it typically follows a generalized pattern and typically symmetrical. Now, this description of joint pain is very nonspecific, and this pattern can be seen in a number of different conditions. When someone experiences these symptoms, it's important not to have visors on and to look for multiple different conditions that could be causing these symptoms. Symptom number 4, parotitis and lymphadenopathy. So we're going to start with parotitis. The parotid glands are located on your sides of your cheeks and are mainly responsible for making saliva. Individuals with Sjogren syndrome will present at times, not everyone, with inflammation of the parotid gland. People can experience as well as swelling, and sometimes the cheek can look a little red. So let's talk about lymphadenopathy. Lymph nodes can be found all over your body, including your neck, behind your ears, around your collarbone, your armpits, the groin, and it's basically, its function is to fight off infection. So it's not uncommon for a lymph node to become swollen when you have something like strep throat. It's basically your immune system doing what it's supposed to do. Now, with Sjogren syndrome, lymph nodes can become swollen for no apparent reason. Typically, the lymph node will be soft, at times can be tender, and will come and go. But when you feel something like this, it's very important to see your doctor because other causes need to be ruled out. chronic fatigue. People with Sjogren syndrome experience severe fatigue that typically affects quality of life in a negative way. It can be difficult to concentrate, it can be difficult to focus, and sometimes can affect work as well as interpersonal relations. It's important to focus on self-care, and it's also important to look for other things that could be affecting or contributing to the fatigue, like looking for things like obstructive sleep apnea, looking at nutrition. Does this person have low thyroid? We do have some medications that at times can be helpful, like hydroxychloroquine, but it's important to approach this in a holistic fashion. Now, I'm going to give you a few bonus symptoms. It's important to note that Sjogren syndrome is a systemic disease. It can affect the lungs, and when it does, it typically causes something called pulmonary fibrosis or interstitial lung disease. Individuals that have this, they present or they experience shortness of breath, typically with activity, and at times can also experience a cough. This is diagnosed by chest x-ray and CT of the chest. Sjogren syndrome also can affect the nervous system. It can cause numbness and tingling sensation in a stocking glove distribution, so hands and feet, but sometimes it can cause numbness and tingling sensation in a very random, unorganized distribution. And finally, Raynaud's is also a common symptom seen in individuals that suffer from Sjogren's. This occurs when the fingers, toes, and sometimes nose and ears become white, as if all the blood was drained out of their limbs. This is very tender and typically brought on by exposure to cold or if you're experiencing severe stress. So there you have it. Those were the 5 warning signs of Sjogren syndrome. Remember, Sjogren syndrome is a systemic disease, and early detection can make a huge difference. If some of these symptoms seem familiar to you, I encourage you to reach out to your primary care physician or local rheumatologist. If you found this information valuable, or if you have any ideas for any future videos, please leave them in the comment section below. Otherwise, I'll see you next week.